So this is Panda. Panda is almost 1. Panda came in with a diagnosis of bilateral luxating patellas, which means that the kneecap slides out of the joint. Normally it slides inward. That's due to sometimes a malformation of actually the knee joint itself. This cat went to one doctor first, and the doctor saw the cat limping and wanted to amputate right away, correct? Mom didn't like that diagnosis, which I agree with. So if she would have listened to that gentleman was it? Man or woman? Okay. Would have listened to that doctor, then this cat would only have 3 legs right now. So she went to another doctor, and the doctor said that the cat had bilateral luxating patellas, which is probably more realistic. Said to wait a whole year without doing anything and then go and get knee surgery, which would cost $5,000 to $7,000. So Mom didn't like that either, which is great, because then she found me, and we did one visit, and Panda was 30 to 40% better. His symptoms, he was walking bow-legged and he was hardly able to jump. So now he's actually using his legs instead of kind of hopping.
Correct.
Okay, so we did one visit, nowhere near $5,000 to $7,000. We didn't have to amputate a leg. We didn't have to do any surgery. This is our 3rd visit. Panda kind of held over the second week. No worries there. Hopefully we continue to head in the right direction. Okay, you ready to go?
Mm-hmm.
Okay. So again, we look for these bounces. When I pull this trigger, see, nothing's supposed to happen, right? That didn't feel too bad, did it? No. So what we look for these bounces, right? And when we get the bouncing like that, it indicates neurological interference is going on in this area. The nerves that control the legs come out of the lumbar spine, so we need these in the brain communicating with this abnormal joint back here. Because what we want to do is, for Panda, this is actually normal. It's not abnormal at all. So what we want to do is we want to get the body to view it as normal if it's all possible. And usually, when I've treated luxating patella cases in the past, cat or dog, I've had excellent results. So we're in the pelvis. See how much less bouncing we're getting back here. So on the first visit, we got bouncing all the way through, all the way down the pelvis, all the way into the knee. So the whole area back here was just irritated. The body was confused. What it's doing all the time is it's doing what I call reactive mode. So the body thinks there's a problem, so it's continually reacting to it. It's causing muscle spasm and inflammation, which then throws the balance off even more. So what this technique does is it allows the body to go into healing mode. So it deals with the problem a little more rationally, and it starts to heal it. Panda's also a lot more calm. Normally Panda's climbing all over the table, so we picked a good visit for the video. Hopefully I didn't speak too soon. So we get a little bit more out of this right upper pelvis here, lower pelvis, and knee. The left side's almost gone, okay? So that's good. When I say gone, I mean I don't get any reactions. Okay, we're going to do a little tail tug. Okay, the tail's good. All right, now we're going to check the neck and shoulders. Normally Panda doesn't really super duper love this, but we'll see how it goes. So again, these are very, very specific contact points. I'm not just firing around aimlessly here. They're energetic and neurologic points on bony landmarks all throughout the body. They're also meridian points like they would stimulate with acupuncture. This is way better for Panda. Let me just bop him on the head. So what I'm trying to do, I don't care if I have a back leg problem or a front problem. What I do is I treat full body on every visit and try to remove every single imbalance possible. So a little bit in the neck still, shoulders, light years better, back better, legs really, really good. Okay, that's great. So we're going to do phase 2 here, muscle work. Okay, again, the bouncing. That's what we're looking for. So we need to relax the muscles in the lower back. And just to be clear, the bouncing's abnormal. So, but we want to find where the areas are blocked, because obviously Panda has a problem that we need to fix if we can. So muscularly speaking, we're still getting some good action down the legs, but neurologically speaking, it's much less. So that's good because the nerves control the muscles, okay? So if I get the nerves working better, eventually the muscles will calm down and they will balance out. Now with cats too, especially with the diagnosis like this, I'm going to go up into the groin a little bit and kind of relax this inside muscle. Because what's happening is the inside muscle and the outside muscle, they're having a tug of war, and because of the luxating patella, the medial muscle, the inside muscle usually wins because of the abnormal formation of the joint. So you could say, holy cow, his knee is totally abnormally formed, and how are we going to fix that? And we need to chop legs off, and we need to do surgery. And sometimes you do. But a lot of times, let's give him a flip. A lot of times, if you can get the body just to relax about it, and just deal with it a little more normally, then the body will heal. And the body will think of it as normal. And the legs won't slide out anymore. So that's what the goal is here. I mean, this is fantastic. So I don't know if you notice or not, but I definitely get a bigger reaction out of the right side than the left. You don't notice a difference in legs. Okay?
I haven't been paying attention either.
Okay, no problem. Okay, we're going to go up here and turn it down. This is definitely the best he's been.
Oh.
So he must know that something's happening too. Okay, we're going to get the magnets. Okay, we're going to use the magnets to help increase blood flow and oxygen into the tissues. Ooh, I got to get his inner leg too. See that? Let me get his inner leg over here. Okay, now magnets. Good boy, Panda.
Calm as a cucumber.
Yeah,
I think he's sleepy.
it's great. Normally he's hanging on for dear life here, you know? What do you think? He's starting to like this now, finally, huh?
No, I think he's just tired because he slept the whole ride.
It's good. You're done, buddy. You're all done. What do you think about that, huh? You did good. It's the best visit we've had so far. All right, he's done.
Awesome.
Okay.